Good morning and welcome. Dr. Godoy, we'll start with you. What can you tell us about the latest in ovarian cancer treatment, particularly for women who are faced with recurrent ovarian cancer?
Well, I would like to talk to you about ovarian cancer and how it's more common than you think. Ovarian cancer affects approximately 200,000 women in the United States. It's the 5th leading cause of death among women. And currently, this concept of it being a rare disease, we're trying to shift the thinking into that more women, our sisters, our aunts, our mothers, our grandmothers, are living with this disease. So we would like to talk to you today about how the paradigm has shifted in the setting of recurrent ovarian cancer, and how there's no longer a watch and wait for this cancer to come back, and how we're using a maintenance therapy to keep people healthy and keep their disease at bay.
And Anna, can you tell us about your experience with ovarian cancer?
Yes. My symptoms at first were extremely everyday, ordinary. I felt bloated. I was tired. And I had a nagging backache. It wouldn't go away. And so it wasn't until I experienced an unusual vaginal discharge that I went to my gynecologist. And 2 days later, after a few tests, a CT scan showed that I actually had masses on my ovaries, and I was diagnosed with stage 3C ovarian cancer. And after my diagnosis and my recurrence, for both of them, I had surgery followed by platinum-based chemotherapy. And after my recurrence, I started on a maintenance treatment.
And doctor, how typical is Anna's story?
Anna's story is the prototypical situation where patients are discovered at a late stage. They have these nagging, non-specific symptoms that brings them to their doctor. Unfortunately, because their symptoms are so non-specific, they're often not diagnosed at an early stage, which leads to an advanced stage diagnosis, most common, like Anna, being a stage 3C. Now, I'm here on behalf of GSK to talk to you about some of the more common treatments that we're using now in the recurrent setting for recurrent ovarian cancer in the maintenance setting and also in the late line setting. It's an oral medication that patients can take once a day. It's the name of this medication. It's in the category of PARP inhibitors. The name of the medication is Zejula. It's a once daily dosing of a capsule, and they can take and have a longer disease-free interval. Now, I'm not telling you that this is a medication for everybody. There are risks out there associated with these medications. Sometimes there can be fatigue, some nausea, vomiting, hypertension, but there has been a paradigm shift, and I'm here to tell you that watch and wait is no longer an option for those patients with recurrent ovarian cancer.
And Anna, what are some things you would want to tell other women who may be going through a disease recurrent?
First of all, listen to your body. You know when something is wrong. And do the research and educate yourself as to the options available to you for maintenance treatment, because knowing that really gives you a sense of empowerment and control over your health care, because there's no better advocate for yourself than yourself. And I'm here on behalf of GSK as a patient ambassador to help educate women as to their options for recurrent ovarian cancer.
Doctor, in closing, what other advice can you provide to women and their loved ones who faced with ovarian cancer?
Just like Anna said, education is the key. One of the places that you can go to get more information would be Zejula.com, Zejula.com, for more information if this is a drug that might be right for you, and to seek your physician for more information.
Well, certainly we thank you both for being with us today to share this important information.
Thank you so much.
Bye now.
Bye.
Bye.